the iRaise program gives a great opportunity to see what the next steps are for you to define, frame, and of course solve your unmet needs. So why iRaise? Well, less than 25% of public funding for research and development results in product reaching the market because they're not driven by the consumer, thus they're not aimed to meet concrete needs. On top of that, over 50% of public procurement initiatives do not reach the expected goals because procurers are not always informed enough about the pros, the cons of different solutions that are available. And then public innovations procurement also represent less than 17% of the total procurement in all European countries. So clearly there's a need there. There's a need for more knowledge. There's a need for increased skills for health professionals to be able to properly define their unmet needs. And that's also related to the lack of knowledge about solutions that exist and the full innovation process and supply chain. So what we know is that the successful adoption of innovation requires a receptive environment, and iRaise, we believe, provide the tools to face different barriers to change and adoption within different healthcare organizations. So in addition to the tools that you'll be given in the program, one of the most valuable features is the iRaise community. And the community includes, not just the project partners, but the different programs, lecturers and mentors. Seeing the lecturers that will support you in assessing the key elements for the adoption of innovation in your organization. Of course, you've already met Aslak, you've met Vicente, and many of those other people, they'll be there in the program. And it's clearly a multidisciplinary team of experts in the fields of value-based procurement, health economics, quality assessment, and of course, innovation development, adoption, and management. And beyond the innovation, you also have many experts in strategic leadership, to just name a few of their expertise. So they're academics, they're researchers, they're practitioners, and they have many years of experience in leading the digitalization and the digital transformation of health systems. So this year is actually the second cohort of the iRaise project, and before it was called UpRaise. And the project has had great teams with different needs and different levels. So to give some examples, we've had an Italian hospital that had limited experience in innovation adoption, but we've also have teams from a hospital within the NHS Trust who had the experience with innovation adoption, but they needed support to upscale a specific international project. So the program applies to the development and design of new project, to refine a project that is in progress, or simply to review an existing project before it is able to be scaled up. So within last year's cohort, they were also quite diverse. For example, we had some projects that addressed clinical issues such as hydrocephalus. There was another project that developed a platform to request or offer expertise for quality improvement. So really my point here is that with the iRaise program, it's not necessarily about, you do not just have the answers for the one unmet need. With the tools that you have, you really can apply them to pretty much any other future challenge you would have in your health organizations. So on the slide, I have some testimonies from our alumni from last year. So they've said that the course helped them in standardizing and streamlining their innovation process. The course helped them to bring new solutions to the clinical setting, which of course is not always an easy task. They've been able to learn from different professionals, both their peers in the course and trainers, but they've also facilitated their staff engagement, improved their patient experience, and ultimately, which is really important, improve their patient outcomes by using the tools that they acquired in the program. So we've already had an event a couple of weeks ago where we had some of our alumni that were presented in a webinar that discussed their experience. And in a little bit, I'll share the link so you could also, if you want to see more about our alumni, more activities about them. And of course, our alumni from last year are still active in the iRaise community, and many of the alumni will also be mentors in this year's cohort. So most of the information I've presented are also available on our social media, whether it's Twitter or LinkedIn. And of course, there's the iRaise website, which is www.iraise.eu. And if there's any questions, there's an email that you could reach us at, but also you can contact Vicente directly in